Hi, my name is Brittany and Riley, and today I'm going to be doing the insulin draw skills video for Nightingale College. I've gathered my supplies here. I have my regular insulin and my NPH. I have my insulin syringe, which is a 29 gauge. It is a 1/2 inch needle and it provides 100 units, which is 1 milliliter. I have my gloves, my hand hygiene, my trash can, my sharps container, and of course my patient here. So the first thing that I'm going to do is look over the EHR and the MAR and verify the 6 rights of medication, which are right patient, right medication, right time, right dose, right route, and the right documentation. So I'm going to verify that again with the EHR in the MAR, and I have the right patient, and I'm going to gather all my supplies. After reviewing the physician's orders, the physician has requested 4 units of regular insulin and 8 units of NPH to be given about 30 minutes before breakfast. So that's what we're going to do. So I'm gathering my supplies and I'm going to go introduce myself to my patient and knock on the door, and they invite me to come in. So I'm going to first close my patient's curtain for privacy, and I'm going to introduce myself. Hi, my name is Brittany. I'm going to be your nurse today. How are you? Fine. Can I have you please state your full name and date of birth? Okay, I'm going to verify that with my patient's wristband, and that is the correct patient. I'm going to let the patient know why I'm here, and we did a blood glucose check on you, and your insulin levels were at, your blood sugar was at 160, which is an appropriate level for us to administer insulin. Your doctor has prescribed 4 units of regular insulin and 8 units of NPH. Some of the common side effects are dizziness and nausea, and some of the adverse side effects would be severe hypoglycemia, which is a very low blood sugar, and hives, which would present as an allergic reaction to the medication. Some common side effects for the injection site is it may sting and burn slightly. That should subside. If you experience any of these side effects, please let me know immediately. This should only take about a few minutes. So is there any known allergies to food, medication, or anything environmentally? My patient states there is not. They have given me consent. So I'm going to get started. My hand hygiene, I'm going to perform hand hygiene, and I'm going to put my gloves on. I'm going to have another nurse come in and verify that I have the 6 rights of medication administration correctly. She's going to verify that I'm doing the correct dose, that it's the correct patient, and that I'm giving the correct dose of each medication. So that altogether would be 8 units of NPH, 4 units of regular insulin, which would be 12 units in my syringe before administration. So the nurse verifies all of that with me and in the EHR with the MAR. We verified at bedside and we are good to go. So the first thing I'm going to do is I'm going to pick up my vials and I'm going to roll them in between my hands to slightly warm the medications and to mix them as well. So there's that. I'm going to uncap my vials here and get an alcohol swab. I'm going to clean the tops of each vial, and I'm going to let those air dry. And as those are air drying, I'm going to get my syringe ready. Okay, I have my syringe here. Without uncapping the needle, I'm going to draw up 8 units exactly of air. I'm going to uncap my needle and I'm going to inject that directly into my vial without withdrawing any medication. I'm going to pull that out, and without touching anything, I'm going to draw up exactly 4 units of air, and I'm going to do the same thing, inject that directly in to my vial of regular insulin. I'm going to invert, and I'm going to draw up 4 units of regular insulin, making sure there is no bubbles. And I have no bubbles. And without administering any of this insulin, I'm going to inject this with my dominant hand directly into the vial. I'm going to invert, making sure none of this medication goes into the NPH, and I'm going to draw up 8 units of NPH so that my vial will show 12 units altogether. Okay, and using the scoop method, I'm going to, with one hand, first make sure that there's no air bubbles, and I see, oops, just a couple of air bubbles, so I'm just gonna expel those very quickly, and I'm still looking good at 12 units. I'm gonna take my one hand, and I'm going to cap the needle, excuse me, one hand method, I'm going to cap my needle like so. And this is now ready to be administered. We're gonna get that done. I'm going to gather my supplies. In this video, we're not injecting the patient per se, but we're going to gather up our supplies. If these medications were not drawn up at bedside, I would label with the patient's name, type the patient's name and the time of dose on each label separately. I'm going to do my documentation. Again, I'm going to document the patient, the time, the dose, the route, the injection site, and I'm going to ask my patient if they have any questions for me. I'm going to monitor my patient to make sure there's no side effects. My patient says thank you. I thank them for their time. I'm going to lower my bed to the lowest position, present the call light, and perform my hand hygiene. I'm going to gather up all my supplies, pass those, hand hygiene, and get ready for my documentation. Okay, thank you.